Meet the new control center for your healthcare practice. Introducing EngageMX Healthcare Reports on Elixir Live.
So this is our EngageMX dashboard, and this dashboard gives us a view of what's happening in our practice from a practice health perspective, financial perspective, and clinical perspective. So you can see we've got our details over here. We can see how many patients we've seen this week and comparative to the weeks prior, how many new patients we've seen, and the revenue this week. We can also have a look at our top ICD-10 codes that we've logged, and at any point we can zoom in to get more specific, and we go 3 weeks back, right? We can also have a look at our top procedure codes, and we can always zoom in at any time going 3 weeks back for more specifics, right? Then we go to our data overview, and we can see when last the EngageMX dashboard received data and for which doctors it has. Then we look at our financial tab. We can always filter here if we want to have a more specific time period. Okay, we can see our current month's revenue versus the previous month's revenue versus the month before that, and the previous week's revenue, and of course always comparative. We can then have a year view of our monthly revenue, and once again we can always zoom in and see the month, the year, and how much revenue we made. We can then look at our average consultation costs, so we can zoom in here, and the number of consultations we had, and monthly revenue by year going into any month of any year going 5 years back. We then have a look at our patients, so new patients last week and comparative, total patients. We have our demographic breakdown, which is really important because we can then look and see what other health services we can be providing to our patient population base based on their demographics. So for example, we have a very high number of females between 40 to 49, so we might want to incorporate more women's health services like screening for mammograms, pap smears and things like that. We have a breakdown here, very important patient contact details, which then when we're building our workflows, we have insight as to what communication modalities we should incorporate. A very good marker of practice growth and practice health is new patients. So we get a year historical view of that. And as always, we can zoom in, and then we have patient consultation intervals. So for example, here we can see that around 30% of our patients only come for a single visit, and it goes and grows, right? And again, we can zoom in at any time. We then have a look at our consultations. So what's really nice here is, again, we can filter by time. Do we want it over the last month, the last year, the last 6 months? By invoice amounts, and then we can even filter by medical professional working in our practice. You can see total consultations, total invoiced, daily consultation counts going back historically, total daily invoices. We can look at patients and consultations per day, looking what is our busiest day and what is our least busy day, consultations by month, and yeah, you can see which are your busiest months. Again, now a monthly view of ICD-10 codes to monitor trends, going back 3 months, and we can always zoom in, and the same goes for procedures. Now it gets really cool, so we can look at chronic diseases, so our total number of unique chronic patients, the average age, average compliance to appointments, and the revenue lost as a result of patients not being compliant. We can then zoom in for each condition to see how many patients we have, the average age and the average compliance, and we can use this as a guide as to what workflows we should be building such that we can improve compliance and also increase our revenue. And then we go into gaps in care, so across our metabolic conditions, who's had an ECG and a dipstick in the last year. Then, as an example, looking at preventative care, it's very important that patients over the age of 45 come at least once to screen for chronic diseases, and you can have a look here to see the total number percentage. Then only 38% of our patients have been seen, so this is a really good opportunity to implement a screening workflow in our workflow section. Then we look at EngageMX. So if EngageMX is activated, you can see EngageMX's performance here, how many patients have returned, total returned patients, and the total additional revenue that has been generated as a result of the system. We then zoom in to see across conditions. We see monthly additional revenue and cumulative revenue as a result of EngageMX, which engagement services are active, and the activity associated with each service. This is really masked, so we get a comprehensive list of all of our chronic patients, We can filter last seen before date or last seen after. We can search by condition. We can search by patient name and if the appointment is due. So for example, we can have a quick glance here and we can see all of our patients, what chronic disease they have, when their last appointment was, and based on our workflows, if they have an appointment due.